Welcome back to the Deep Dive. Today we're tackling a topic that probably sounds quite serious to most people, even if the details are a bit fuzzy, meningitis.
Mhm.
And to really get into it, we've been digging into some really good sources. There's a detailed review on pediatric viral meningitis, another piece focused on the bacterial side in kids, and a study looking at how long antibiotic treatments should really be. So our mission today, not just throwing facts at you, we want to weave together what these sources say to give you a clear evidence-based picture. What is meningitis, what causes it, who gets it, how doctors diagnose and treat it, and sort of what's the latest thinking. It's like your shortcut to getting properly informed.
Yeah, and these sources are great because they really zoom in on kids and they highlight the huge differences between the viral kind and the bacterial kind. We'll pull out the key stuff from each one.
Okay, let's dive in then. So at its most basic level,
Yeah.
what is meningitis?
Right. So fundamentally, it's inflammation. Specifically, it's when the meninges get inflamed.
The meninges.
Mhm.
Those are the protective layers around the brain.
Exactly. The membranes that cover and protect your brain and your spinal cord. Think of it like those protective layers getting swollen and irritated.
Okay. And the sources mentioned this can be caused by infections, but sometimes other things too.
That's right. Although our focus today, based on these papers, is mostly on the infectious causes, viruses, bacteria, sometimes fungi. They do mention non-infectious triggers exist. Things like certain diseases affecting the whole body, some drugs, even cancer sometimes. But yeah, we're really focused on the infections here.
And that big split you mentioned, viral versus bacterial, that's super important, right?
Oh, absolutely critical. The sources really hammer this home. Viral meningitis, you might hear it called aseptic meningitis. It's generally milder, often slower to develop.
Okay.
Bacterial meningitis or septic meningitis, that's usually much, much more serious. It can come on fast and it can definitely be life-threatening. Getting that difference is key.
Right. Let's dig into the causes then. If it's infectious, what are the actual culprits?
Well, the sources are clear that overall, viruses are actually the most common cause of meningitis, period.
Interesting. And for the viral type, especially in kids, which viruses pop up most often in the readings?
Yeah, for pediatric viral meningitis, or PVM, the big players are a group called enteroviruses.
Enteroviruses. Like what?
Things like Coxsackie virus, echoviruses.
Yeah.
Those are really common culprits mentioned. But there's a whole list of others too. Herpes viruses like HSV or chickenpox virus, human pareschoviruses, influenza A and B, even some viruses spread by mosquitoes like West Nile.
Wow, quite a list.
Yeah, and mumps used to be on that list as a common cause, but thankfully vaccination has really knocked that down. Even SARS-CoV-2 is mentioned as a rare possibility.
Okay, so lots of potential viruses. What about the bacteria that cause meningitis?
For bacterial meningitis, the sources name a few key ones, especially thinking historically about kids. Haemophilus influenza type B or Hyde, that was a huge one.
Ah, Hyde, right.
And then Streptococcus pneumonia, pneumococcus, and Neisseria meningitis meningococcus. Those are the big three often associated with severe bacterial meningitis.
And you mentioned vaccines before. That ties in here.
Absolutely. It's a massive success story highlighted in the sources. Routine childhood shots against Hib, pneumococcus, and meningococcus have drastically cut down how often we see these really dangerous forms of bacterial meningitis. It's huge.
That's really good to hear.
Yeah. Other bacteria can cause it too, of course, like E. coli or group B strep, particularly in newborns, but those vaccines have made such a difference against those main threats.
Okay, so let's talk about who gets it. The epidemiology. Are there patterns?
Yeah, and the patterns are really different for viral versus bacterial. Viral meningitis actually infects more people. It has higher morbidity rates, but the mortality, the death rate is way, way lower than for bacterial.
How much lower are we talking?
Well, one source cited historical studies with pediatric viral meningitis mortality around 4.5% versus over 14% for bacterial. More recently, another suggested it was more like 0.002% for viral versus 2% for bacterial. Still a big gap.
Wow, that really puts the severity difference in perspective.
It really does. Age is a huge factor, too. Both types can hit newborns and infants harder because their immune systems aren't fully developed yet.
Made sense.
For viral, one study saw peaks in infancy and then again around age 5. Bacterial meningitis tends to peak in young kids and then again in the elderly.
Any other patterns, like time of year?
Yeah, viral meningitis often spikes in the summer and fall. That's linked to when enteroviruses are most active. Some studies also suggest boys might get viral meningitis slightly more often than girls, though the reasons aren't totally clear from the sources, maybe behavioral factors perhaps.
Interesting. Okay, let's shift to how it happens inside the body. The pathology.
So at the simplest level, it's that inflammation of the meninges we talked about. For bacterial meningitis, the pathogens, the bacteria, usually get into the body, often setting up shop in the nose or throat first.
Uh-huh.
Then somehow they manage to cross the blood-brain barrier. That's the filter that usually protects the brain. Once they're across, the inflammation they cause can actually make that barrier leakier, which might let even more bad stuff in.
And for viruses, is it the same pathway?
It's interesting, the sources actually say the exact step-by-step process for how viruses cause meningitis, the sort of detailed pathophysiology, is still not as well understood as it is for bacteria.
Huh. Okay, so maybe you don't feel quite right. What are the actual symptoms? How does meningitis show up?
Well, the sources stress that, especially at the beginning, the symptoms can be really nonspecific. They can look like a lot of other common illnesses, particularly in kids.
Like what?
For viral meningitis, think flu-like stuff. Fever, headache, maybe sensitivity to light, that's photophobia,
Yeah.
a stiff neck, muscle aches, feeling tired, losing your appetite, maybe vomiting.
Yeah, that really does sound like the flu or a bad cold. Must be hard to tell early on.
Exactly. That's a huge challenge. Now, bacterial meningitis often hits harder and faster. The classic signs are usually described as a sudden high fever, a really bad headache, and that stiff neck, what doctors call meningismus.
Okay, that sounds more alarming.
It is. And in severe cases, especially bacterial, it can progress quickly to things like confusion, altered consciousness, seizures, signs of increased pressure in the head, or even shock. Sometimes a specific type of rash can appear too, particularly with meningococcal meningitis.
What about those physical tests, like bending the neck or straightening the leg? Kernig's, Brudzinski's.
Yep, the sources mention those. Koenig's sign is when it's painful or difficult to straighten the knee when the hip is bent. Brudzinski's sign is when bending the person's neck forward makes their hips and knees drop automatically.
Do they work? Are they reliable signs?
Well, the sources are pretty cautious here. They say the reliability, especially in kids, is kind of controversial. Their sensitivity, how often they're positive when someone does have meningitis, can be low.
So they might be negative even if someone has it.
Exactly. They're still checked for, but they might not be present in many cases, particularly in babies and young children. There's another one mentioned, jolt accentuation of headache, where shaking the head makes the headache worse. That might be a bit more helpful in some settings, maybe more to rule out meningitis if it's negative. But none of these signs alone are enough to diagnose it or even reliably tell viral from bacterial.
Okay, so symptoms are tricky. Physical signs aren't foolproof. How do doctors actually nail the diagnosis then? What are the key investigations?
Right, this is where the lab really comes in. The sources make it clear that the absolute cornerstone for diagnosing meningitis is analyzing the cerebrospinal fluid, the CSF.
And you get that with a spinal tap, a lumbar puncture?
Exactly. A lumbar puncture, or LP, is usually essential. The decision involves weighing the clinical suspicion against any risks. For instance, if a doctor strongly suspects bacterial meningitis in a child with fever and seizures, an LP is usually a high priority.
Are there times you wouldn't do one right away?
Yes, if there are signs of really high pressure inside the skull or certain other contraindications, they might do a CT scan of the head first to make sure it's safe before doing the LP.
Okay, so they get the CSF sample. What are they looking for in that fluid?
Several key things, and this is where they start to differentiate between bacterial and viral causes. First, they count the cells, especially white blood cells.
Okay.
Bacterial meningitis typically causes a really high white blood cell count in the CSF. Mostly neutrophils, think of them as the body's first responders to bacterial infection.
Got it. Lots of neutrophils means likely bacterial.
Generally, yes. Viral meningitis usually has a lower total white cell count, and the main type of cell is often lymphocytes, different kind of immune cell. But there's a catch. The sources mention that very young babies with viral meningitis can sometimes have more neutrophils early on, which can muddy the waters a bit.
Oh, okay. What else do they look at?
Glucose and protein levels. Bacteria tend to gobble up glucose, so in bacterial meningitis, the CSF glucose is usually low. And because of all the bacteria and inflammation, the protein level is typically very high.
And viral.
Viral meningitis often has normal or near normal glucose, although some viruses like mumps or herpes can cause low glucose too. Protein might be normal or just mildly elevated, so you see, it's about looking at the whole pattern.
Right, putting the pieces together.
Exactly. And then, crucially for bacteria, they do a gram stain, a special stain, to look for bacteria under the microscope right away, and they culture the fluid, trying to grow the bacteria to identify it precisely and see which antibiotics will work against it.
Are there other tests that help? Blood tests?
Yep, standard blood tests like a complete blood count, CBC, and checking inflammatory markers like C-reactive protein, CRP, are done. CRP is usually very high with bacterial infections, sometimes a bit elevated in viral too. They also check electrolytes like sodium because low sodium can happen in both types. And the sources mention CSF lactate. That's another marker that tends to be much higher in bacterial than viral meningitis, so it can be a useful differentiator.
What about pinpointing the exact virus if it looks viral?
That's where molecular testing has been a huge leap forward. PCR polymerase chain reaction is called the gold standard in the sources for detecting viral genetic material in the CSF. It's super sensitive.
So it can find even tiny amounts of virus DNA or RNA.
Exactly. And now there's multiplex PCR, which can test for a whole panel of common viruses all at once from the same sample. And even newer tech like next generation sequencing or NGS can potentially screen for a vast range of viruses, bacteria, and fungi simultaneously.
Wow, that sounds incredibly powerful.
It really is. It helps get answers much faster and more accurately than older methods like trying to culture viruses, which was slow and often didn't work well.
So pulling that together, the main diagnostic challenge is telling bacterial from viral, right?
Yeah,
Especially at the start.
absolutely. That's the critical differential diagnosis highlighted because the management and the urgency are so different.
And you use that whole CSF picture, cells, glucose, protein, lactate, plus the specific tests like gram stain, culture, and PCR.
Precisely. Those lab results are key, combined with the clinical picture, of course. Things like the time of year might give a clue towards viral, but it's not definitive. And as we said, those physical exam signs aren't reliable for telling them apart.
Okay, so let's walk through the approach. Someone comes in, you suspect meningitis. What happens?
Well, the sources suggest a really rapid assessment. Get the history, do the examination, look for those warning signs. If meningitis, especially bacterial, is on the radar, the decision about doing that lumbar puncture happens quickly, assuming it's safe.
And treatment often starts before you even have all the answers.
Yes, especially if bacterial meningitis is suspected. Given how dangerous it can be, doctors will often start empirical antibiotics, meaning broad-spectrum antibiotics that cover the most likely bacterial causes right away, often even before the LP is done or while waiting for the results. Better safe than sorry.
Right, you can always stop them if it turns out to be viral.
Exactly. But you lose precious time if you wait to start them in a true bacterial case.
Makes sense. So let's talk treatment specifics. For bacterial meningitis, what's involved?
Prompt antibiotics are the mainstay. They need to be drugs that can get into the brain effectively, crossing that blood-brain barrier. The initial choice, as we said, is often empirical, based on age and local antibiotic resistance patterns. Things like third-generation cephalosporins, maybe with vancomycin if resistant pneumococcus is a concern, are common choices mentioned. Once the bacteria is identified from the CSF culture, the antibiotic might be tailored.
How long does treatment last?
It varies. The sources mention anywhere from 7 days up to 21 days or even longer, depending on the specific bacteria, the patient's age, and whether there are complications. One of the sources specifically looked at treatment duration, noting it's still an area where the absolute optimal length isn't always perfectly clear.
And is it just antibiotics or other things too?
Supportive care is vital. Managing fluids carefully, sometimes you actually need to restrict fluids slightly because of the risk of low sodium monitoring electrolytes, managing fever. And then there's dexamethasone, a corticosteroid.
Steroid. Why is that used?
It can help reduce inflammation, and studies have shown, particularly for hive meningitis in kids over a certain age, it can decrease the risk of long-term complications like hearing loss. Its use depends on the specific bacteria suspected or confirmed and the patient's age. The evidence isn't as strong for all types of bacterial meningitis.
Okay. And what about treatment for viral meningitis?
For most types of viral meningitis, the sources say treatment is primarily supportive. Because the illness is often self-limiting, meaning it gets better on its own, the focus is on managing symptoms, pain relief for headache, fever reducers, rest, fluids.
So no specific antiviral drug usually.
Not for most viruses like the common enteroviruses. However, if the meningitis is caused by a herpes virus like HSV or VZV, chickenpox shingles virus, then specific antiviral medications like acyclovir are available and definitely recommended, as they can make a real difference in those cases.
Good to know there are options for some specific viral types. We've touched on advances like diagnostics and vaccines. Anything else highlighted as recent progress or ongoing research?
Yeah, the molecular diagnostics PCR, multiplex PCR, NGS are definitely the big stars in recent advances mentioned in the sources. They allow for that rapid, accurate identification of the cause, which is huge for guiding treatment, potentially reducing unnecessary antibiotic use, and shortening hospital stays if it's confirmed viral.
That seems like a massive practical benefit.
It really is. And as mentioned, there's ongoing research trying to pin down the absolute best antibiotic durations for bacterial meningitis. Plus, work continues on finding even better biomarkers, things you can measure in blood or CSF, to help differentiate virals from bacterial even faster, or maybe predict who's likely to have complications. And the sources consistently circle back to the success of vaccination programs. That's an ongoing public health story with huge impact. And just to reiterate on complications, while viral meningitis is often mild, problems can happen, especially in the very young or immunocompromised. Things like seizures, or more rarely, longer term issues like developmental delays or hearing loss are possible, though generally less common or severe than after bacterial meningitis.
And for bacterial, the risk of those lasting problems is much higher.
Much higher, yes. Bacterial meningitis is a major cause of acquired neurological disability, especially in infants and young children. Significant hearing loss, seizures, learning disabilities, motor problems. These are serious potential outcomes. It really underscores why acting fast is so critical.
Wow. Okay, that was incredibly thorough. We've really unpacked meningitis, drawing on all that detail from the sources. We covered what it is that inflammation, the different infectious causes, viral versus bacterial, who's most at risk, how it affects the body, the often tricky symptoms and signs, the absolute importance of that spinal fluid analysis for diagnosis, the very different treatment strategies, and the impact of vaccines and new diagnostic tech.
Yeah, we really saw that crucial distinction between the usually milder viral types and the potentially life-threatening bacterial forms. And the power of vaccines is just undeniable. Plus, seeing how much faster and more precise diagnosis is becoming with tools like PCR and NGS, it's really changing the game.
So thinking about all this information, this spectrum from mild viral to severe bacterial meningitis, what's the main thing you, our listeners, should take away?
I think it really highlights how important it is to seek medical attention if you or your child has symptoms that could be meningitis, especially things like high fever with a severe headache and stiff neck, or altered consciousness. While many cases, especially viral, will be mild, you need that expert assessment to figure out what's going on, because if it is bacterial meningitis, every minute counts. Getting diagnosed quickly is key.
Right. And here's something to really think about. We talked about these advanced diagnostic tools like next-generation sequencing that can identify almost anything. As these get faster, cheaper, maybe even portable, and as we learn more about the subtle ways different viruses or bacteria trigger inflammation, could we be heading towards a future where diagnosis is almost instant, right there at the bedside, leading to incredibly tailored treatments based not just on bacterial or viral, but on the exact strain and the individual patient's response? What might that look like in, say, 10 years? Lots to consider. Thanks for joining us for this deep dive.